Are you having some neck pain with tingling sensation going down your arm, shoulder, and your upper back? Welcome back to my channel, Annie Pilates Physical Therapist. This video I'll be discussing about C6 and C7 herniated disc with neck pain, and I'll show you some gentle exercises to help with this inflammation and irritation of the nerve that comes out between these vertebrae. So get your mat ready, a scarf, and a pillow or a towel to start with. Let's first discuss the anatomy of our neck. There's 7 cervical vertebrae, 1, 2, 3, 4, 5, 6, 7. As you go further down, the disc in between these vertebrae gets thicker. The major shock absorption for our neck. And because our head, which is our skull, is usually heavy, it's like a bowling ball. So average weight, they said, is 12 pounds, depends on the size and the weight. And because of our lifestyle, sometimes we have a normal lordosis of our neck. We ended up with our cell phone in the computer looking down, causes a tightening of your neck muscles, and then you ended up with a flat neck or sometimes increased lordosis. And with that, the disc, which is made of a fibers, we call it the annular fibers, and then there's a nucleus pulposus in the middle, which is like a gel-like structure, usually made of water imbibed, and when you move your neck, it moves around, and usually it gets irritated and pops out of the disc because of wear and tear, degeneration, or an injury, or chronic positioning. And with this position, you ended up the disc. Usually, is the most common disc herniation is the C6 and C7 because it has the most disc and most mobile, one of the most mobile for our neck. Usually C7 and thoracic is the most mobile, but because of the disc on C6 and C7 has a lot of muscles supporting and attached on it. The muscles that are attached on C7 spinal process are the traps, the multifidus, and the cervical spinalis. So with these muscles, it gets really tight and weak. So that's why I have this scarf and towel to start with. So the first exercise we're going to do is we're going to put this towel or scarf around your neck area where the C6 and C7 area is. With this inflammation, you'll see a lot of numbness and tingling sensation on one side. So my recommendation is to use the side of your stronger arm without irritation and without the weakness. And because of that, if you use the bad side, you might get this more irritated. My recommendation, of course, is to see a doctor and have an MRI on your neck to make sure you're really positive, because the most common disc herniation is posterolateral, where the disc goes out to the side. But if you have a disc herniation going inward or anterior medial, this is not the right exercise for you. If it goes forward or goes back and middle, that irritates the spinal cord already. So if you have weakness going down your leg already, then you know it's not just the disc irritation is really bad already, because there's 5 types grades of disc herniation, and grade 5 is a slip disc already, and we want to make sure you don't want to make this irritated more. So please see a doctor if that's the case. But for those who are still milder and just a little bit numbness and weakness, then this is appropriate for now. So with this, you put it in that area, and then you look straight, and then you gently pull it up, and as well as you're slowly looking up, and feel that tugging stretch, and hold it. Usually hold it for 5 seconds for beginners, and then slowly increase it up to 10 seconds hold. So again, you grab a scarf or a towel and gently tug it forward, not too tough, not too strong, gently as you feel the release, and down. Because I said earlier, I have no cervical disc herniation, but My recommendation is to use the good side so you can practice with your good arm without the pain, and slowly go up. And hold this. I'm gonna do sideways so you can see, as high as you can, and you slowly progress, and the more you can go backward. And because of this irritation, the dermatomal level of this C6 and C7, you can also pain and weakness on your rhomboid, so you ended up with the scapular weakness or winging of your scapula. So these are the exercises I'll show you as we progress. So today is mostly stretching. I'll do a follow along video next for this exercises after you've done this for at least a week, before we do a strength training program with the thoracic TheraBand. Because if you start doing this strength training without stretching first, you might irritate your neck more. So stretching this way is the best way to start with. And after doing that, then you can do some nerve glides. So it's like flossing your teeth, but this time you're flossing it on the nerve near the irritation of the inflammation of your disc. The first one is the median nerve. So there's 3 major nerves as they come together from C1 to C7, and it branches out on your armpit area and goes all the way down here. So the first one, my recommendation if it's really inflamed, is to do it lying down. And then you slowly bend your knees to support your spine, and then slowly open your arms out, fingers pointing down and looking straight, making sure your shoulders are comfortable on the pillow, your head is supported, and back. You can also roll a towel or this scarf and support it on your neck area, so you're not irritating the disc. Then slowly pull your belly button in to engage your core. Take a deep breath through your nose and blow through your mouth, while hugging like a big tree, and slowly opening it out, fingers pointing down the floor. And you can do this in your bed, so you can further go all the way down to stretch the nerve. Flossing this nerve, it helps tug the area, helps the inflammation on your neck. So do that at least 5 seconds, hold up to 10 times. So the next one is ulnar nerve. So this one, you clasp your fingers. If you do it in sitting in your desk, in your computer, and you're really irritated, and then you pull up after twisting your wrist out, and you can feel a stretch all the way to your pinky area, and then down and here. So if you want to start lying down in the morning when you wake up, well, you put the roll towel on your neck, twist out, and pull all the way out with your breath. Don't forget your breathing. You inhale through your nose to the center and down. Again, do it 5 seconds, hold up to 10 times. And the third nerve is the radial nerve. So radial nerve supplies our thumb area. You clasp your fingers, hug yourself in a cross, open and twist it backwards, so you feel a stretch on your forearm area. So that's the radial nerve, and when you do that, it pulls the area all the way down here. And my recommendation, if the disc herniation is in your left, tilt your head to the right and you feel that stretch more. So you can do it as well in lying down. If sitting up is too much pressure on your neck, because that's with gravity, it causes the disc to be irritated more. So when you're lying down, you're not against gravity. So cross, open, and twist, and then tilt your head away from the herniated disc, and you feel that tugging pull, and then hold it for 5 seconds. 4, 3, 2, 1, and then go back to the center, and then hug yourself. My recommendation, open, lean away from the herniated disc, floss to the center, and cross. Do that as well up to 10 times. So that's what we call nerve glides. The fourth way that you can help the disc is to do some chin tucks. So when you do chin tucks, make sure your shoulders are out. You can get the back support. Your fingers on your chin area and push back. Not pushing with your chin, just a reminder, you're utilizing your neck muscles. if this is too hard for you, to make sure you're not looking down and not looking up, doing it straight up, get a mirror, see your posture, and go back. And if you're tilted towards the disc, that's not good as well. Making sure you're really straight and not tilted. So that's why you have your chin with your fingers to remind yourself to be straight. And that's, you can feel a tugging stretch on the muscles that's really tight. Okay, and then you can also do that in lying down with the neck support with a pillow all the way down here. And then you can do chin tuck if it's too much for you to do it in sit. Pain goes down more on your hand, then it's getting worse. We are trying to centralize the pain. And the fifth one, we grab a towel again, and you can also do the stretch. Remember, we did it in sitting up earlier. One, put it on your neck, go at the edge of your bed, have a pillow here, and then while you're slowly pulling up, you're looking up. And you feel that lovely stretch on your neck. And hold it for 5, 4, 3, 2, 1, and down. And do that as well 10 times. So those are the gentle stretching and gliding of your nerves to start with. If you do this every single day, at least twice a day, it helps the inflammation. My recommendation is also put some heat on your neck to start for 20 minutes to warm up the tissues. And if you notice the next day it's getting worse, then stop. But sometimes it takes a week to see progress. If you know it's just more muscle tightness and you feel sore, that's okay, because you're stretching muscles that you never stretched before. And then as we slowly progress, I will show you how to strengthen these muscles as I described earlier the anatomy where these muscles will support your neck. So we're going to bring out an elastic band to slowly strengthen, a gentle one to begin with. The next exercise is isometrics. Isometrics means you're not going to do a movement pattern, but you're strengthening it in a static position. So if you have weakness on your right side, we want to focus on this weakness, and usually your cervical muscles here are really weak and tight. So when you do a contraction on the muscle and then we'll do stretching after, it helps relax the muscles more. So if example is this is the side, you're going to put your palm of your hand here and slowly resist it. You can start with just simple 5 seconds hold. 5, 4, 3, 2, 1, and relax. Making sure you engage your core muscles still with your breath. So inhale through your nose and blow and contract with this one side weakness. So it's going to be sometimes difficult to lift your right arm. So my recommendation is to use the other arm, the stronger side, and hold it for 5, 4, 3, 2, 1, and blow to relax more the contraction. So usually you can do it in all different directions. So if there's a pinching pain when you turn to the right, don't do it. But if there's no pain, then resist also going the rotation to the right, because you need these movement patterns. So you're gonna resist it while going to that motion, and you stop before the pain and you take a deep breath and hold it for 5, 4, 3, 2, 1. You can start gentle, 5 seconds hold, even just a few seconds hold, like 1 to 2, and then slowly build it up to 5, and then 10, and then up to 10 repetitions. It's also beneficial to resist the good side to keep everything balanced on your neck muscles. So take a deep breath, 5, 4, 3, 2, 1, and relax. And after doing this gentle isometrics in all directions, after a week of doing this with less radiculopathy and there's more centralizing of pain, doing all of these exercises, then you can progress with the elastic band. I will do a follow-along video with this program, a resistance band, and doing everything with you. The last exercise is stretching, so you're gonna slowly stretch to the side. You can put the palm of your hand on the mat to have stabilization, so you're not lifting it up. Keeping your back straight and pull it out. Take a deep breath and then slowly twist up and stretch. Feel a lot of stretching on your sternocleidomastoid muscle and blow. And do that as well. 5 seconds hold up to 10 reps. So you're gonna go away from the herniated disc and you feel a release and then back. So if it's your left side where you have the disc, again, put your palm of your hand here and slowly lean first to the side. So this is a nice side flexion and then rotation. So what we're doing deeper muscles on your multifidus muscles and your cervical semispinalis. And then we're gonna do a little bit of a yoga. So you're gonna go to your hands and knees and we're gonna do some cat and camel. So this helps because sometimes your low back muscles gets tight with neck problem and your core muscles. So it's nice to engage your core gently without hurting your neck. So even in this position, you might feel it's difficult. If you're not ready to do cat and camel, it's fine. The more you do your other exercises, this will get better and easier. So you can start pulling your stomach in, look down, take a deep breath like an angry cat, and then slowly go up. Your tush out, you feel that gentle tug on your low back muscles and look up as high as you can and blow. And my recommendation is hold 5 seconds in each way with your breaths. 5, 4, 3, 2, 1, and slowly go up. Take a deep breath and blow and hold it for 5, 4, 3, 2, 1, up to 10 repetitions. I know I'm just doing this everything in demonstration, but on our next video, after you're doing this every single day, you might feel a little bit relief in the beginning or sometimes not. It takes a lot of time and patience, but if it's getting worse, I really recommend you to see a physical therapist near you or a doctor to have more testing done on your neck. I'm hoping you learned a lot on this video. Please like and subscribe my channel. Ring the notification bell for future updates just like this one. I upload videos every Wednesdays, Fridays, and Sundays, sometimes Mondays for Pilates, physical therapy, yoga, wellness, and health. I would greatly appreciate if you can like and thumbs up on this video. And you can also follow me on my social media, my Facebook, Instagram, and Reddit for more details and different social aspects when I share my videos. Until next time, have a great and healthier you. Bye!